Okay, welcome back. Sorry, we had to take a break real quick. Um, we're going to go ahead and go through the cranial nerves, starting with one which we don't have to check, but I'm going to go ahead and list them all. One is the olfactory nerve, and what we do for that one to test it is we have the patient close their eyes, and we provide three different odors that are distinct that everyone would know what they smell like, and we have them occlude one nary and sniff with the other one, and then change nares and sniff with that one, and make sure that they can correctly identify the odor. So what we use is coffee, peppermint, and vanilla, and those are all things that most people would know what they smell like, so that's what we use for that. Cranial nerve number 2 is the optic nerve, and we did check that with the Rosenbaum chart, where Maureen scored 20 vision. I am going to do an exam of her fundi. Okay. Right, sorry. And I'm able to visualize her arteries of her eyes. There's a red-white reflex. Okay. And also for optic, we check for pupil constriction, and we do that with a pen light. And her pupils are equal, round, reactive to light, and accommodation. We checked her visual fields earlier when we did the fingers out to the sides, as well as the H pattern that checks the 6 cardinal fields of gaze. So optic nerve number 3 is the oculomotor nerve, and with that you also check, these kind of go hand in hand, you check for pupil constriction with the pen light, which we just did, and I'm going to ask Maureen to open and close her eyes. And she has no problem doing that. Her eyelids close completely. For trochlear, which is cranial nerve number 4, that's the 6 cardinal points of gaze, as well as perla, which we've already done. And abducens is the extraocular movements, which is when we do the H pattern, which we performed previously during this assessment. Cranial nerve number 5 is trigeminal. So for this one, I'm going to palpate her temporal and masseter muscles as she clenches her teeth. And I don't feel any crepitus or anything abnormal. She's able to have smooth muscle movement when she clenches her teeth. So another part of the trigeminal is to do the cotton swab to the forehead, cheeks, and chin, which we did in an earlier assessment. So we're moving right along to cranial nerve number 7, which is the facial nerve. So I'm going to go ahead and ask Maureen to smile for me and frown. Okay, now I'm going to have you close your eyes tightly while I try to open them. Good. And lift your eyebrows. Show your teeth. And puff your cheeks. Now, if we did suspect facial nerve injury, then we would go ahead and do the taste test, which tests, it's a third of your tongue for each one. The very back of the mouth would be where the sour taste would be present. The middle of the tongue would be salty, and the front of the tongue would be sweet. And we usually only do that if there's a suspected facial nerve injury, or if the doctor specifically wants that performed. So cranial nerve number 8 is the acoustic nerve. Maureen and I were able to carry on a conversation, so with our general appearance, I knew already that she was able to hear my voice and was able to respond appropriately. We did the whisper test, which Maureen did excellent with. She got every single one of the letters and numbers correct. We did the Weber test, which is where I put the tuning fork that's vibrating on top of her head. And if the patient were to say that they heard the sound better in one ear than the other, then what you'd want to do is repeat the test and occlude one ear at a time, and the patient will hear the sound better in the ear that's occluded. We also did the Renee test, which is where we placed the base of the tuning fork against Maureen's mastoid bone, and we timed it while she listened to it vibrate and told us whenever the vibration sound stopped. We noted the number of seconds with that. It was 11 and 21 one time, and then 10 and 20. So that's bone versus air conduction, and the air conduction should also always be 2 times what the bone conduction is, and hers was almost exactly twice of what the bone conduction was. So cranial nerve number 9 is the glossopharyngeal, and we did that as well, where I depressed Maureen's tongue with the tongue blade while she says ah. I did check her gag reflex as well, and it was intact. Cranial nerve 10 is the vagus nerve. That is where you do the ah and gag reflex. I apologize. Cranial nerve number 11 is the spinal accessory nerve, and that's where you ask the patient to rotate their head forcibly against resistance, which she did earlier as well. And she had no problem in doing that exam. And what you do is have the patient rotate their head forcibly against resistance to the side of the chin or sternomastoid. We had her shrug her shoulders, but I'm going to do it again with more resistance. Very good, Maureen. And it should be strong and symmetrical, which it is, the trapezius muscles. Cranial nerve number 12 is the hypoglossal, and this is where we ask the patient to stick the tongue out and note forward thrust in the midline. So we did do that earlier, but I'm going to have Maureen do that again. Good. And she had no problem. Her tongue didn't deviate to one side. It was midline. And can you move your tongue from side to side? Good. And lastly, can you repeat the words light, tight, dynamite?
Light, tight, dynamite.
Good. So that's the cranial nerves. We're now going to jump back into the musculoskeletal system, and I'm going to check her reflexes. We have 3 that we're going to check. We're going to check the brachial on her arm, we're going to check her knee, and her Achilles tendon. And we're going to do this bilaterally. Good. So that's intact. Good. Okay, now I'm going to do her knee. And watch out, you don't want to stand in front of somebody because you get hit. Good. Okay. And now we're going to do the Achilles tendon. So with this one, you lift up on the patient's foot and hit the back of it. Good. So those were the reflexes that we did. Now I'm going to check her muscle strength. And what I'm going to do is have her hold her arms out, kind of like you're doing the chicken dance. And I'm going to try to attempt to push down on her arms. And she has equal strength and is very strong, symmetrically, equal strength bilaterally. I'm going to have her squeeze my hands as hard as she can. Good. And I'm going to have her push down on my hands like she's driving the car. Very good. And pull back towards you. Perfect. So all of her her grips, pushes and pulls are all strong. So there was no weakness on any side of the body. We'd be worried about that, especially if there was a suspected stroke. but hers were symmetrical bilaterally. So now what we're going to go ahead and do is examine her cervical spine, which is C1 through C7. And we want to just make sure that there's a normal curvature and no masses or bulges. So I'm going to go ahead and assess that. And it starts at the base of the skull. Any pain or tenderness?
No.
Okay, very good. Okay, so her cervical spine has normal curvature to it. Again, there was no masses or bulges, and she didn't experience any pain during it. So now I'm going to go ahead and check her lumbar spine, which is between the pelvis and the ribs, and it's L1 through L5. So I'm going to have Maureen stand up and bend over for me. And try to touch her toes. And I'm just going to kind of feel along her whole entire spine for any abnormalities. Okay, you can stand up. And I did not feel any. We would be worried about kyphosis, which is where they're hunched over, or scoliosis. And a lot of times kids will get that done during their school year as part of like a routine testing. So this concludes our video on a head-to-toe assessment. And thank you for watching.